Hi. So we just begun talking about the changes in a woman's body during pregnancy. So here is before conception. The size of the uterus is about the size of a fist. And 4 months pregnant, just up to the umbilical cord, belly button line. And at 7 months, it's even higher. In full months of pregnancy, it's all the way up to the xiphoid process. You can also see that towards this time, the head should be down. And you can see that in this case, the baby is upright, which is a common position. So some things that happen in the digestive system of the woman, nutrients and metabolic changes. So one thing that happens is increased insulin resistance due to increased levels of certain hormones, estrogen, progesterone are two of them. And this can lead to gestational diabetes in the mother. Not always, not for every woman, but it can happen. Morning sickness is something that doesn't happen in the morning, or can happen all times during the day. And a lot of women experience just in the first trimester. Not really well understood, but believed to have something to do with hormones. Some women, just a little nausea. Some women need medication help because it's that bad. Also, there's problems with the GI tract. Essentially, the smooth muscle doesn't move as quickly as it does. It's more relaxed. So the materials remain in GI tract for long periods. This creates constipation. The organs feel cramped, obviously because of the size. It can lead to something called hemorrhoids as well, outpocketings of the tissue in the anal area. Nutrition. Women do gain weight with pregnancy, and that's healthy to do that. Depending on your size to begin with, whether you're underweight, overweight, or normal weight, there's a recommended range of weight to gain. Most healthy, normal weight women will gain anywhere from 20 to 40 pounds. And the weight gain is due to the size of the actual growing fetus, the growing placenta, the growing breast tissue, the size of the uterus increases. Weight is also due to fluid retention, especially in my first pregnancy. I probably had, pounds, 5 to 6 pounds of fluids just that my body was retaining. And then extra adipose tissue. A woman during pregnancy should consume extra 300 calories per day to grow a baby. Also, there's more nutritional requirements, more folic acid needed, calcium, protein, and iron than a woman would normally need. Gestational diabetes, some information about that. The woman doesn't have diabetes before gestational diabetes. Pregnancy essentially triggers it. The symptoms don't usually start appearing until the second trimester, and usually around that time there's a test done where a woman has to ingest a large amount of glucose, and then they measure her blood levels of insulin. And they do that all in the clinic. And there's dangers to gestational diabetes, high blood pressure, other complications. One of the major complications is having just a really large baby. Increased risk for cesarean section, birth complications, hypoglycemia, essentially the baby's born starving. Yeah. And then it's maintained with a healthy diet. And increased risk for type 2 diabetes later in life, which I find interesting. Also, moving on to another body system, cardiovascular system is affected. Since you have more blood volume than you normally would, actually it increases, the plasma volume increases by 50%. 50, okay? We're talking 50% more blood volume, which means your heart has to work harder. The cardiac output increases 30 to 50%. Stroke volume increases, and your heart rate to maintain adequate blood flow. Blood pressure, because of those things, can change, like this diagram showed, that Elise showed you, that the blood pressure initially increases, but then it goes down, it goes back up to normal. If you have higher blood pressure at the end, that's dangerous. Also, just a few other things related to the blood vessels. There's not adequate return of blood to the heart from the veins due to the compression of the fetus, and this can cause varicose veins. And that's your blank here, hemorrhoids, like I talked about earlier, and then swelling. Here's a picture of the swelling. Respiratory system is also infected. Okay, um, the uterus is all up in your grill, and it's harder to breathe. It's hard for the diaphragm because the uterus is all the way up to the top of the xiphoid processes. That's right where the diaphragm is. So the diaphragm can't fully go down all the way, so it's hard to take a deep breath. Because of progesterone high levels, it lowers blood carbon dioxide levels, which facilitates higher diffusion rates of the respiratory gases in the placenta. And the mother's body needs to make sure that it's providing adequate oxygen to both mom and fetus, so it's going to have increased tidal volume, more going in and out, increased pulmonary ventilation, so you're going to breathe more often. The respiratory rate, that's what that is. And then just you're going to use more oxygen to keep up with the needs. Urinary system, we already talked about more urine output. That has to do with increased blood volume and then just compression of the bladder. Because everything's being compressed, the ureters actually can be affected as well. So that makes women more prone for urinary tract infections, Preeclampsia, Elise talked about, but what that is where essentially it's extremely dangerously high blood pressure during pregnancy, normally in the second half, close to the end. There are some risk factors that you can read there. Cause is generally not understood very well, but hypertension or high blood pressure can lead to it. So those are general risks for hypertension. But just because you have these risks doesn't mean you're going to be preeclamptic. Essentially, the placenta is not getting adequate amounts of oxygen because of the high blood pressure. And the woman can start getting headaches, increased swelling or edema, protein in the urine, which means that because the blood pressure is so high that normally the protein wouldn't come out of the blood, that it does. The only way to cure it is to give birth. Eeclampsia is a worse version of preeclampsia. Can cause seizures, medical emergency. So know what the action of oxytocin is. Hormone responsible for darkening of the areola, and what happens to the respiratory system during pregnancy. And that's the end.